Hi, my name is Melanie and I am your IVF nurse. Today's topic is just some basic fertility question and answers that I've been collecting over the week from friends, family, people I don't even know but have had people ask on my behalf just if they had questions, what would they be. So to start, one of the first questions that was asked was what causes infertility, what signs are there of infertility, and what are the typical treatments. So what causes infertility can be a number of things, and sometimes it's unexplained, which is a diagnosis that many people will have. So some of the things that do cause infertility would be decreased sperm in men. If a patient has been diagnosed with PCOS, because they may not be ovulating, women that are underweight or do not have regular periods, patients that have had maybe a previous pelvic infection that has not been treated, or if maybe they did many years ago and it wasn't treated and it's developed some scar tissue, so there may be issues related to that. The typical treatments that are involved would be your consultation, where you do a diagnostic workup, and then once you've determined what the issue is, you could either do timed intercourse cycles, and this may include oral medication. Then the next step would be doing insemination cycles, and same again, it could include oral tablets or subcutaneous injections as well. And then the last step would be actually doing IVF, so stimulating ovaries and having a procedure to retrieve eggs, and then fertilizing the eggs with sperm and then watching them grow or having them cultured to blastocysts. So those are the typical treatments, and it is usually like a ladder. So most people will start off with timed intercourse cycles, then progress to insemination cycles or IUI cycles, and then if that's not successful after a few months, they move on to IVF. So that is that, and everything is very specific to your own diagnosis. So it may be recommended that timed intercourse isn't for you, and that you'd have to do IVF right away, depending on what the findings are in your diagnostic workup. Now, the other question that I received was, what are the effects of diet on infertility? Now, it's not so much as diet, because you do want to be making sure that you're eating a balanced diet. It's more so related to lifestyle. So if you're smoking marijuana, those things affect sperm quality. Of course, you want to avoid recreational drugs of any sort, both male and female. Patients would need to avoid those. Drinking alcohol is a big thing as well, so you want to be minimizing the amount of alcohol that you're taking in prior to trying to conceive, and then of course when you're going through your treatment, you're really not going to be drinking anything at all. Usually what they say is, when you're stopping something like alcohol or caffeine or drugs, in order for you to have or see a positive effect, you need to have stopped for at least 3 months prior to beginning your journey. So that's the key thing. But other than that, with diet, you want to make sure that you're drinking enough fluids, that you're eating a balanced diet, and that if you don't think you are, that you're taking a prenatal vitamin for women, or men can take a supplement as well if they don't feel that they're getting enough in their diet. If you know that you've already have issues with sperm, then it would be of interest to you to probably take a supplement with selenium or zinc or something else that would help with sperm and sperm counts. Now, the next question that was asked was, what does sperm freezing entail? Are there appointments, and how much abstinence is required? So every clinic is different, but the basics of it is that you need to do infectious disease screening prior to your sperm freeze. An infectious disease screening will check for things like HIV, syphilis, hepatitis, so all of those things that can be communicable, transferred through bodily fluids. Now, in terms of appointments, clinics will ask that once you've done your infectious disease screening, that you book your appointment. These appointments are usually Monday to Friday, and they're usually done in the morning because it does take the lab some time in order to freeze the sample, and there may be issues with samples, so there may be a callback or a rescheduling of the appointment, and you do want to make sure that your appointments for sperm freezing, you do attend them. You don't want to leave them unattended because there are other people that may be waiting that you've taken the spot up for, and then they're kind of stuck without doing their sperm freezer, having it delayed, and maybe there's other issues involved. So you do want to make sure that when you're booking your appointment that you are going to be able to show up and not have to cancel. The other thing that's important is that you want to be abstain. So abstaining usually for 3 to 5 days would give you an optimal count for sperm. If there's a callback, then you may be asked to return in 2 days or something like that, but usually abstaining for 3 to 5 days is sufficient, and they're able to get good enough answer from the quality of your sperm when they're freezing, if there's any issues with it, and it'll give the optimal count as well, because sperm usually needs about 48 hours to regenerate. So next on my list is, can having an abortion cause infertility? So usually the answer is no, it cannot. Given the fact that you were pregnant, if you choose to terminate the pregnancy, that's a completely individual decision to make. But the fact that you were able to get pregnant actually reflects how fertile you are, which any doctor, when they're doing your medical history, your intake, that's important to know. And I know a lot of women out there, they may have had an abortion with a prior relationship, and maybe their husband doesn't know or their current partner doesn't know, but this is something that you at least want to let the doctor know. And if you can't let the doctor know because, say, you didn't want to tell your partner, then what you would do is at least let the nurse know, just so that they can document it that you have been pregnant in the past. Now, with having an abortion though, if you've gone to a reputable clinic, and not something that was, I don't know, shady or back alley, and I think most clinics in Ontario are very reputable. After the procedure, if there were any concerns or questions that the doctor had that may have happened, or if they needed to collect more data because of an incident that happened during the procedure, they would let you know if there was any concerns that would possibly affect your fertility. But if you got the all clear to be discharged, and the doctor did not approach you, or there was nobody from the healthcare team that raised any concerns, then the understanding usually is that everything went well. So this is why it is important to let your fertility specialist know, or your doctor know, if you've had an abortion or not, because this could then put you, it gives them more information when they're doing your clinical workup. Now, the next question is questions related to egg freezing in the process. Does it make having children in the future naturally more difficult? The answer is no. There are many people that do IVF or egg freezing, and then they will spontaneously get pregnant after. So ideally, when you're looking at egg donors, CFAS recommends up to 6 IVF cycles. ASRM, I've actually read documents that will say that 12 cycles are acceptable. I have my own opinions about that. However, 6 cycles for CFAS, they say, is sufficient. So usually, having 1 egg retrieval or 2 egg retrievals, I've seen many patients where they kind of throw in the towel and then they spontaneously get pregnant on their own. So it's hard to say if there's any scar tissue that develops, but once again, as long as these procedures are done by a reputable physician, and there's no concerns noted at the time of the procedures of anything that may have happened during the egg retrieval, then theoretically, if you were, say, egg freezing, then if you do meet a partner down the line and you choose to have children, then you should technically be able to conceive. Okay? Now, their other question related to this is that somebody had asked, is it normal that I want to freeze my eggs for my 30th birthday. I actually think that's a great idea because you can never predict what's going to happen. Usually what we like to see are patients freezing their eggs before the age of 35, because we do know that after the age of 35 that there is a steady decline in egg quality. So this is what's going to affect when they thaw the eggs, if they need to. So when you're ready to conceive, if you've frozen some eggs and you're over the age of 35, it's going to affect the thawing rate and possibly fertilization. So the younger you are, your eggs are going to be supposedly of better quality. So you're looking at doing egg freezing. I think it's great. You do have a few years, so you don't necessarily need to do it when you're 30, but it's something that you would want to consider prior to turning 35. But I feel it's completely normal and good on you for wanting to do that, because like I said, you can never really predict what's going to happen in your future, and you may not need it, but it's kind of like a good insurance policy to have. Now, the other thing I wanted to mention is that when you're doing egg freezing, it is just like the IVF process. And when you are ready, if you're at a point in your life where you don't have a partner and you've got frozen eggs, what you're going to do is reach out to your reproductive specialist, and you will need to have a sperm sample shipped in, or maybe you've got a designated donor that you're going to be using. But what will happen is that your thawing of your eggs and creation of embryos is going to be treated like a frozen embryo transfer. So depending on your clinic and what they use, your protocol will be that of a frozen embryo transfer. So they thaw the eggs to create embryos, and then they're planning to do a fresh transfer. And then sometimes what they will do as well, depending on at what age the eggs were frozen, the doctor may indicate to you that it would be a good idea to do genetic testing on these embryos that are created from the frozen eggs. So that's something else to consider as well. But the younger you are in terms of freezing your eggs, so between the age of 30 and 35 is definitely ideal, and that's what we would like to see. That's what we're getting good clinical responses from in terms of egg freezing. Now, the other question related to egg freezing is what's the cost? It's very similar to an IVF cycle. Unfortunately, OHIP does not currently cover social egg freezing, is what it's called. So you would be paying out of pocket. So for private services of IVF, it depends solely on your clinic. You're looking at anywhere from possibly $8,000 to about $12,000 or $13,000, and then that does not include annual storage fees of frozen eggs, as well as medications that you're going to be using when you're stimulating your ovaries. Medications, the younger you are, the less you need. So for someone who is 30 years old doing IVF or egg freezing, you're probably going to need about maybe $2,000 to $2,500 worth of medications. Someone who is closer to 40 freezing their eggs, they might require closer to $5,000 worth of medications. So when you're doing this, once you've met with your reproductive endocrinologist and discussed moving forward with egg freezing, you will be meeting with a nurse. You'll have somewhat of an education session either on site or just prior to, or on the morning when you're starting your IVF cycle, where medications will be discussed with you, and you can look into that in advance to see if you've got coverage through your own private insurance. But you're probably looking at about, I would say, anywhere from $8,000 to $12,000 for the egg freezing process, the stimulation, the blood test, the ultrasounds, and then an additional $2,000 to maybe $5,000 for medications, depending on your age. Now, another question that is related to egg freezing is the age limits to egg freezing. So ideally, I think most clinically, the doctors would prefer patients under the age of 38. However, we do see a lot of patients that are late 30s, so 39, early 40s, 41, 42, that are looking at egg freezing. And because it is fallen under the private pay, doctors will do it. but they should be discussing with you the statistics of what's going to happen when those eggs are thawed, and how many times you may need to do the egg retrieval process in order to get a batch of eggs, because with egg freezing there's really no way of knowing the quality of those eggs until, one, you take them out, and two, when you're creating embryos and culture them to blast, so when you're ready to use them. So it's really, really hard to say what is the limit to egg freezing in terms of age, only because each clinic is very specific, and some won't freeze eggs for women over the age of 35, some it's 38, some it's 42, but you want to be realistic when you're speaking with your doctor about the egg freezing process. Now, another question that I received was, how many times can a person do IVF before it is recommended that they stop? Now, every person in Ontario with a valid OHIP card is entitled, and under the age of 43, is entitled to one funded IVF cycle. That being said, clinics will always opt to allow patients to pay for additional cycles. I've seen it where patients have done 8, 9, 10 cycles in 1 year back to back. Not all of those cycles were successful. Not all of those cycles had a successful egg retrieved or even created embryos, but that was like 10 cycles of stimulation to see what the person's response would be. So there really are no limits if IVF is your be-all and end-all. The doctor may advise you, once you've done, maybe 3 cycles that have failed, that maybe, and depending on your age, that maybe it's time to consider an egg donor. But if you are adamant or not ready to move forward with an egg donor, then most doctors will cycle you until you've come to that conclusion that you've gotten your closure that you're looking for, that that you've done everything that you can do, and not necessarily throw in the towel, but you may be looking at doing other options. But everybody's limit into how many cycles they are willing to do varies from person to person. I've met with patients where one patient may say, yeah, after this cycle I'm done, and then a couple months later they've thought about it and they come back, and I'm just like, wow, I thought you said you were done. So it's just a lot to consider about moving forward, but realistically, there are no limits. Everybody has their own, limitation. And I've also seen patients that do IVF and then they revert back to timed intercourse cycles or insemination cycles. So there's really no limit as to what you can do in terms of your next steps. However, you do want to be smart about it, because if you do become pregnant, say you do IVF and then that doesn't work and you decide to revert back to timed intercourse cycles or IUI cycles, if you're over the age of 40, there are things that doing IVF can tell you that doing an insemination can't. And that would mean doing, say with IVF, eggs are retrieved, embryos are created, and then you could do genetic testing to make sure that the embryos are normal that are being transferred. Whereas when you're doing an insemination or timed intercourse cycle, there's no way of knowing that until you're doing your prenatal screening. So you may have those 12 weeks of wondering if everything is normal, which is the worrisome part for most patients. The next question that was asked was, what is the timeline involved with doing IVF? Is there pain? Are there guarantees? And what's the recovery time after an egg retrieval? So the timeline for IVF, the stimulation phase can be anywhere from 9 to 12 days. Now, some people do have a longer cycle, which would entail maybe 15, 16 days of stimulation going in for ultrasound blood tests. Every clinic is similar to how they do their monitoring. So you should get a protocol that outlines your visits when you're expected to come in, and then those should be updated, your instructions, every time that you do go in, if there's any changes or days off or changes in dosing. Now, what ends up happening is that there are some clinics out there where the typical stimulation phase requires you to attend an education session, and then when you have your day 1, you're coming in on day 2 to start the injections. You do your ultrasound and blood test, and then some clinics will have you come back on your day 5, so 4 days after starting medications, and then they might have you come back 2 days later, and then they might have you come back on day 9 or day 10 to see where you're at. So that being said, it's usually anywhere from 4 visits to every day, depending on the clinic and the doctor's preference and really what's going on in the cycle. So if you're doing IVF and an egg retrieval, then what you want to do is allocate probably about 2 weeks of your life where you're going to be going in, doing ultrasound and blood test, and any days off that you get would be a bonus for you, but monitoring is a commitment, and it's important to know before doing this that you're aware of how much time is expected of you to go into the clinic, because it's the only way for the clinic and the doctors to know how you're responding and if there's any doses, and how to actually set out or confirm your timeline for your IVF procedure. Now, with regards to guarantees, there are no guarantees when you're doing IVF. Unfortunately, everything you invest can go up into smoke, so to say, but it does give you your best shot. So usually, depending on medical history, it's hard to say. Usually clinics will say, you know, about 48-50%. And this comes down to medical history. Are there sperm issues? Age, how many embryos you're putting in, if they're day 3, if they're day 5. If it's a funded program, you're only transferring in single embryos unless you've fallen under that other criteria. So there's a lot to consider. So unfortunately, there are no guarantees when you're doing IVF. Now, with the questions related specifically to the egg retrieval, is there pain? So you do feel pressure from the transvaginal ultrasound, or it looks like a wand. And what ends up happening is that it's inserted into the vagina. So there is pressure when the doctor is pushing. Sometimes the ovaries can be difficult to access, so they may be pushing from the top of the abdomen. Sometimes they need to go abdominally to access the ovaries. Now, you will have a nurse who sedates you in most clinics. There is probably a couple of clinics out there in Ontario that will have an anesthetist that comes in, and you may fall in and out of sleep, and this is even when nurses are sedating, where depending on your reaction to medication, you could be awake and talking and not feel much, or you could fall asleep, but as long as you're breathing and you're easy to rouse, then the doctor is okay doing that. There are a few women out there as well who, I would say that they may not metabolize the medication very well, so they do say that it is painful. However, once the stress of the procedure is done, then they're saying to their partner or a support person, oh, that really wasn't that bad. It's just how their body metabolizes the medication at the time, because the anxiety and the stress that they've put themselves on affects their initial response to the medication. But the goal is, during an IVF procedure, when you're having your eggs retrieved, to keep you as comfortable as possible, because that's how we know that the procedure is going to be done safely. If you're awake and uncomfortable, having pain, that could potentially cause problems, because most people, when they're having pain, they move, they may pull back, they might jump, or not literally jump, but shake on the table, which can cause problems, and the doctor would have to stop the procedure. So ideally, they want to sedate you enough so that you're comfortable and not feeling any pain. If you're awake during the procedure and you're having any discomfort, I've always advised patients to let us know, because we can always give you more drugs. Most times when we're giving drugs, there's always a side effect of nausea and vomiting, but we do have medications in stock that counteract that. So the nurse will take care of you, and like I said, the goal is to keep you as comfortable as possible when you're having your egg retrieval. Now, with an embryo transfer, there is no medication involved. The most uncomfortable thing with that is that you have a full bladder and that the ultrasound technician is pressing on your abdomen, and that the speculum goes in. So a transfer itself usually takes about 2 to 3 minutes if the doctor's on time. An egg retrieval, they're usually booked in 30-minute increments or 45-minute increments. It's solely dependent on the number of eggs. If you've got 2 eggs, you're probably in and out of the procedure room 10 minutes. If you've got 20 eggs, you're probably looking at closer to 20 minutes in the procedure room. In terms of recovery time, usually for embryo transfers, after 30 minutes, most places will let you go. Some let you go right away. With an egg retrieval, you're usually there about an hour. However, the nurses need to make sure you're okay. You cannot drive on the day of an egg retrieval because of the sedation that you're going to be receiving. So that's always important. You want to make sure you have someone with you who's going to drive you home. The other thing is that the following day for an egg retrieval, you can technically go back to work, but keep in mind that you're going to be a little bit tender or sore. The doctor did put a needle into your vagina up into your ovary to drain your follicles. So being sore, tender is very, very normal after an egg retrieval, and sometimes it's, a little bit, about a week, maybe a week to 10 days before you actually feel back to normal. For an embryo transfer, most clinics will recommend that you take 2 to 3 days, including the day of transfer, off. Not solely bed rest, but you do want to be taking it very, very easy. The nurse who is discharging you after an embryo transfer, or if you're receiving your instructions prior to your embryo transfer, will review the specifics of the doctor's preference of what they want you to do. The last questions that I have is IVF covered under OHIP or benefit plans? So every person in Ontario that has a valid OHIP card and under the age of 43 is entitled to one funded IVF cycle. However, because there are more than, I think, 20,000 people that are after 5,000 spots, it makes it really difficult. So there are wait lists involved, lottery systems involved. So you want to make sure that you're checking with your clinic about their policy on the funded cycles. Private benefits, I've only seen it ever covered through a healthcare spending account. So this is for people that usually have they're self-employed and they've got some kind of healthcare spending account that they've put money into that is kind of on reserve for things such as this, or things that may not be covered through OHIP or through supplemental insurance benefits through your employer. Benefits may cover some of the drugs. What you want to do prior to doing any of your IVF cycles is get a list of the medications that the doctor is going to be prescribing, and get those drug identification numbers. We refer to them as DIN numbers. And then from there, you want to be calling your insurance provider and giving them the specific DIN number. If you call and say to them, my fertility doctor is prescribing this medication, do I have coverage? Most times they hear the word fertility and they won't even bother to look, and they'll say no, because these medications are very, very expensive. So what you want to do is say, oh, my doctor is prescribing these medications. This is the DIN number. That way they actually have to go into their computer system, punch in the numbers, and tell you what your coverage is. The other thing I always recommend as well is to get the name of the person that you've spoken to, because many times different representatives may tell you different things. So that's important. The last question I have is, what is the percentage of women who have experienced infertility? So the statistics that are known to us is that 1 in 6 couples will face infertility. So that's based on heterosexual couples. So that doesn't include women in same-sex relationships, single women. A lot of the times, single women or women in same-sex relationships may think that it's just lack of sperm, and it very well could be just lack of sperm. However, when you're actually going through the process and doing that diagnostic cycle, or having your attempts of going through inseminations or IVF, that's when you're going to find out really. So clinically, what they're saying is 1 in 6 infertile couples exist. I believe it may be more, like maybe 1 in 4, 1 in 5. I still think that there is like a cultural stigma. People are embarrassed by it. So maybe you know somebody who's going through it. You may be going through it yourself and you haven't spoken to anybody. You don't know what to do. So there are some good resources out there available to you if you are going through infertility, or you think it may be a problem and you're not sure. One last tip, since I've just kind of tipped on this and nobody really asked me about this, but usually if you're in a heterosexual relationship and you've been trying, if you're under the age of 35 and you've been trying to conceive for about a year, it's time for you to see your doctor, get a referral to a fertility specialist, and then from there get worked up and see if there's any issues. If there's no issues, fine, maybe it's just timing, but after a year, that's usually the guidelines that we say. If you're over the age of 35, I've told friends, family members, 6 months tops, because after the age of 35, we all know that egg quality declines. There's lifestyle factors, there may be other factors going on that we don't know about, and you want to get those looked at and be having children sooner rather than later, because that is the ultimate goal when you're going through a fertility clinic, or when you've decided to make that decision to create a family or expand your family. So that is my discussion for today. I hope it was very informative to you. I hope I covered most of the questions that I got this week. Once again, my name is Melanie. You can check out my webpage at www.yourivfnurse.com, or if there are any questions that you may want me to speak of in a future episode, you can email me at yourivfnurse@gmail.com. Thanks for watching.